Hi everyone. Welcome to RSB Healthcare Consulting. Best practices for accurate HCC coding. Engage in staff education and awareness. If your medical billing service, clinical staff, and administrative team members aren't cognizant of your HCC efforts, they can't help you achieve successful capture measures. Engage in role-appropriate training, then activate your staff to take action toward improvement. For example, task an employee with reviewing a list of patients with undocumented HCC diagnoses to identify the patients who do not have scheduled visits for the remainder of the year. Why? Because those patients can be scheduled for an appropriate office visit to help with HCC tracking and risk profiling for your practice. Revisit retrospective HCC coding. Providers always capture detailed diagnosis information for their patients in visit notes, but they may not include documented diagnoses in the final claims for visits when they enter their billing codes. If diagnoses are not in the claim, they are not counted towards the patient's annual HCC total. Audit your processes to see if that's happening at your practice. You need accurate coding processes in place across inpatient to outpatient and office settings to establish a comprehensive process that captures complete HCC considerations. You should also lay out all associated tasks and responsibilities of the engagement in a contract or binding agreement. Conduct data analysis and DAMP. Establish controls. Auditing your process should be your first toward putting stronger analytical HCC measures in place. Evaluate your current state success and determine whether physicians are routinely capturing complete HCC relevant diagnosis information. How much risk information do you have on your patient base? Where do you have gaps? From there, see if your technology solutions can help you out. Diagnosis guidance provided within the provider's EHR workflow can serve as a reference as they evaluate, document, and bill for each patient visit, a safeguard to help providers capture the HCC-linked diagnoses for each patient. Ensure an accurate problem list. Many healthcare organizations have been inputting data in an EMR system for years now, resulting in lots of information, and most likely an inaccurate problem list. Ensuring an accurate problem list involves removing duplicative and inactive diagnoses, identifying key areas with discrete data in the EMR, and using a diagnosis preference list to include HCC suffix codes and RAF values as well as prioritize results. Track performance and identify improvement opportunities. The last, and perhaps most important key initiative of the workgroup is to track performance and identify future opportunities for improvement. Measuring results provides the workgroup with compelling data to bring to stakeholders, and these results can show what improvements were made, such as an increase in average RAF score, improvement in key problem list diagnoses, decrease in the number of members without an annual visit, an increase in the percentage of persistent condition diagnoses resolved. Once the workgroup has data to bring to stakeholders, the next step is to identify future opportunities for further improvements. One place to look for these is by reviewing unresolved persistent conditions for specific populations. Thank you for your time. Contact us to collaborate on our email info@rsbhealthcareconsulting.com or our website www.rsbhealthcareconsulting.com.